Hello, Dr. Hashmi here. Now, today I want to talk about something very interesting. I'm just a psychiatrist. My brief introduction is I'm Dr. Hashmi. I'm just a psychiatrist. I've been practicing for the last over 30 years. Now, the topic I have chosen to talk about today is Am I depressed? The reason want to talk about this, whether am I depressed or not, because for years and years and years, I have come across people who were clinically depressed but were not aware of it. And then I came across people who were not depressed and had already been tried on all sorts of antidepressants in the world. Now, getting a prescription for an antidepressant is much easier than buying a loaf of bread. This is the way system is. So it is important to know whether individual is depressed or not. You got to know yourself to start with, who you are. And then you would know whether you are depressed or not. So that's what I'm going to talk about. Now, especially focused on men as well. I'm going to focus on men in my conversation because men usually don't realize they are depressed until it gets to a serious stage. I have come across individuals, especially men, holding high powered positions, and they have not realized slipping into depression for years before something happens. Something means some incident. And what type of incident? Either they just break down into tears or they just stop facing the world, go into a total meltdown, and that's when they realize, yes, I've been struggling for 5 years, but I never realized that. But it works with both genders. We continue using our psychological resources even when the resources go on to the last reserved mode. It's very much like the tank of your car. You fill it with fuel, you have driven it, and then after a while, it actually goes into the reserve section of fuel. And once you finish that reserved fuel, the last red elements, the last red little mark on your dashboard or the fuel indicator, your car will stop. That's exactly the way human mind works. There is no difference in it. We have psychological resources, we use it all the time, but then a time comes when the psychological resources go on the reserve mode. And when they go on the reserve mode, done. How long can you drive? You only realize it when your mind comes to a standstill. And that is when it gets much more challenging to help someone out of that depth of depression. So, how would you know whether you are depressed? How would you know that the process is already started? Your mind has already started consuming psychological resources more than what you expect mind to do when things started going out of hand. And once the process starts, that is what happens in life. a process always takes its logical end, even if it doesn't appear logical to us. Still, there is always some logic to it. When depression process start in mind, it is bound to take its course. But you need to know when and how. Now, the first thing, which is the most important thing you need to notice in yourself, it's relevant to both genders. But the reason I mention about men, because men don't tend to recognize depression soon enough. Women do tend to recognize depression quicker than men, but men tend not to, and that is probably cultural element to it, probably their upbringing to it, probably they expect them not to be seen as depressed, or they have to continue with the strong man persona. So even if they understand, or even if they have some realization deep down in their heart that they are depressed, the acknowledgement, the acceptance of it is not always there. So the first thing you need to do is to look at the biological functions. To know yourself, whether you are depressed or not, the first thing you need to look at is your biological functions. Because biological functions are the first indicator to give you some light, some understanding of the direction of travel. And what are these biological functions? The most important is sleep. We all sleep at different times, wakes up different times. We all have our own inbuilt sleep-wake cycles and the settings in our psychological systems. The discussion is not around whether you sleep 4 hours as a routine, 5 hours as a routine, or your routine is to sleep 10 hours. The whole point you need to look at, the aspect you need to look at is, has there been any change in my sleep-wake cycle, uninfluenced by any specific factor or factors? We are going to come to that factors in a minute. But if someone's sleep-wake cycle is disturbed by reason of taking some specific medication, or there is a recent life event which has affected sleep-wake cycle, then it is another issue, and we're going to discuss it in a minute. But naturally, if everything is going fine, there is nothing specific happening, but still you see a difference or a change in your sleep-wake cycle, out of the blue, you have started to struggle to fall into sleep. Out of the blue, you have started waking up earlier than expected. Your sleep has become lighter, or you have started sleeping with frequent interruptions during the sleep, not for any specific medical reason, because sometimes people have medical conditions which doesn't let them to sleep in that sense, and sometimes they have to wake up a few times. Most commonly, a lot of people wake up at night to go to the toilet. Irrespective of, take these things out of it and just look at your sleep. The the quantity and the quality. Has there been any change in the quantity or the quality of your sleep? Sleep is the biggest indicator. And usually, it is the first indicator which gives you an idea that you might be heading towards depression. And this happens. This is very, very common. So look after your sleep. Look after your sleep. I am going to talk about the management alongside the disturbance of biological function and symptoms of depression, because if you understand yourself, if you understand your biological functions, if you pick any disturbance in any of your biological function and you fix it straight away, quickly enough, you will have far more quicker and easier journey to deal with. If you neglect any disturbance, if you neglect anything which you have picked up or not realized it is there, then of course you are at risk of slipping down into quite deep depression. Now, so sleep is a biggest issue. The first thing is sleep. So look after your sleep. Any disturbance in your sleep, uninfluenced by any specific factors, is a big indicator that you are traveling towards depression. Second, appetite. Has there been any change in your appetite? Are you eating enough? Or are you having food with the same interest as previously? Are you interested in food, maintaining your interest, maintaining your passion? If you are still asking for food when you, as you have always done, are you still maintaining and requesting your loved ones to prepare the specific foods for you, or are you preparing it for yourself? What is the level of interest in food you have? And that is integral to your that is integral to your stability. If your interest in appetite maintains, if your interest in appetite maintains, then it's unlikely that depression will set in. When we talk about food, it's not only the quantity we talk about. As we sleep, we have looked at the quantity as well as the quality. The same goes with food. It's not only the quantity, we are talking about the quality of food as well, the quality of interest in food as well. So basically, you need to look at, are you enjoying your food the same way as you have always done, or you are just filling yourself with food? We know that every individual's priority or level of appetite is different. It is the change we are looking for. It is the change which we need to pick. So the start of depression, very start of depression, we need to pick the change in our sleep. We need to pick change in our appetite. Now, 9 out of 10 times, the disturbances towards lacking sleep, lacking appetite. Most commonly, When we start developing depression, we sleep less. We struggle falling into sleep. Our sleep gets interrupted. We start waking up earlier than expected. So the quantity and quality of sleep is shortened. Same goes for appetite. Most commonly, we are going to lose interest, our love for food. We will stop enjoying the foods which you have always enjoyed. The quantity will reduce as well as the quality of your interest in food. It will be very much like a filling exercise because you are still feeling hungry, or you still feel hungry after some interval of not eating anything or drinking anything, and you just tick the box. These are the two most important things. Then what else are we talking about? Physical intimacy. Have you lost interest in it? Has there been any change? Irrespective of the fact that the intimacy changes with time and life, but are we still enjoying the presence of our loved ones around us? This is the third biological aspect, very important aspect. Are we enjoying the presence of the loved ones which we have always enjoyed? And that is, I'm only talking about at most domestic level. Any change? So we have talked about appetite, we have talked about sleep, we have talked about the general interest in intimacy and love for people we always loved. Now take a bit of a further step. When I'm going to talk about the sleep and appetite going other way around before we move to the next set of symptoms. Now, as I said, that most commonly sleep will reduce in quantity and quality. Our interest in food will reduce, and the food itself will reduce in quantity. Sometimes you see the arrow going to travel in another direction. We end in oversleeping and we end in overeating. That could be the sign of depressive disorder. So it's not only lacking sleep and appetite, it is also the biological functions traveling in the other direction. So you feel the need to sleep more than usual, and even the daytime you are ending sleeping. And you will see the need to overeat even when you are not hungry. Then that's again a sign of disturbance. So what we are actually wanting to know is the change. Change in your sleep, change in your appetite, change in your level of intimacy and feelings for your loved ones. Now, this is one set of symptoms, and these are the ones which are affected the most. The second set of symptoms is again very physical, and you can actually pick it up, and you can mark it, and you can feel them. Because some of the symptoms are going to be picked up and felt by others, not you. And we class them as somatic symptoms. We class them as symptoms which actually comes and felt from us as individuals. And what are those symptoms? We all operate on certain level of energy, certain level of interest, certain level of passion, certain level of planning, certain desire, certain level of desire to progress. Now, physically, we start feeling tired. Now, when we talk about feeling tired plus low mood, always get your physical health checks, because there are a lot of physical health conditions which present very similar to low mood and tiredness. And very easily it is misunderstood as depressive disorder. It might not be. It might just be vitamin D deficiency. It might just be anemia because vitamin B12 is not getting absorbed properly. It might be something else. It might be thyroid gland is not producing enough thyroxine. So lack of energy, low mood can easily be produced by physical reasons, and which has nothing to do with depression. Yes, if left untreated for many, many moons, of course it's going to affect your mood. Of course it's going to give you a clinical picture similar to depression. But if you are feeling energyless, lethargic, tired, you got to get yourself physically checked, especially for vitamin D deficiency, especially for hypothyroidism, especially for anemia. Get your bloods tested first. And if there is a deficiency of anything which requires fixing, get it sorted. That will make your life 100 times better. You might not need an antidepressant. And one of the reasons of talking about this topic, am I depressed, is because there are a lot of people out there who have been taking antidepressants for many years and not getting better. Why? Depression is common, but marginally greater prevalence than other disorders. But having said that, when it comes to prevalence of various mental disorders and personality disorders, it ranges within the same parameters. There is no huge difference. And for to remember in your mind, the easiest thing to remember, which I have used, is that prevalence of all mental disorders individually, whichever mental disorder you look at, is somewhere between 10 to 12%. So depression is the same. But we perceive as depression is very common, far more common than other disorders. And I, as said earlier, that getting a prescription for antidepressants is much easier than buying a loaf of bread. And that's exactly happens a lot of times. So basically, the first thing you need to recognize when you're talking about whether asking yourself question, am I depressed? Biological functions. Sleep, appetite, intimacy, love, affection, that sort of thing. Second set is physical. Tiredness, lack of interest, not enough energy, digestion is not right, I eat, I don't get digested, food not digested, my GIT is not working properly, my stomach is not working, I'm getting a bit of uh, irritation in my chest, I'm getting my burning sensations in my stomach, I'm not really opening bowels every day. What's happening? All these things, if you put together without any specific mental disorder, physical disorder, any specific physical disorder, they all are together, one could see it as sign of depression. Then the third big thing is the mood. Ask your question, am I happy? Now there is a difference between depressive disorder as a clinical diagnosis which required treatment and a management with medications, psychological therapies, and various other methods of treatment available. But on the other hand, these treatments are beneficial in clinical depression only because that is when the treatment is needed. Having depressed mood, having a predisposition to see glass half full as a part of individual personality or an element of pessimism or a pessimistic thinking process as a part of individual is not depression. So a lot of times if you meet somebody or if you go and see the doctor and you talk about, yes, I'm depressed, I don't feel like doing anything, but this might be you. One needs to explore what has changed. And that change identifies or signifies the possibility of depression. Now there is a big, huge area of change in attitude as well. What happens is, this is something which we as an individual might not recognize or realize. But our loved ones or people who know us well recognize it more quickly. That is attitude. Are we becoming more irritable lately? Is the person become more difficult to live with or talk to? Do you see work colleagues getting annoyed because of that person, but previously they never felt that way? But now the work colleagues thinks that, oh, do I really want to talk to him or her? So there is a change in attitude. Change in attitude makes you irritable, angry, unnecessarily argumentative, or if you look at the other side of the scale, socially isolated. I just can't be bothered talking to anybody. It's better not to say anything. That sort of attitude. So losing an overall interest, becoming more irritable, frustrated, angry, difficult to cooperate, difficult to work with, not really able to take a reasonable argument on board. All these things indicates that depression is setting in. Then another aspect to it is the duration. Whatever I have said, if this happens for a day or 2 days or a week, 10 days, fine, you're not depressed. Because duration is too short. So all the symptoms I have talked about got to stay there for certain length of time. Means the criteria, different various criterias we use for the diagnosis purposes. Usually they say about 2 weeks at the minimum duration for persistent presence of all the symptoms I have talked about. But it could be more, usually 2 weeks individually as us as individuals. If we have sleep appetite issues, we lose interest in doing things in life, we lose interest in the pleasures we used to get pleasure from, all these things, or if you get irritable, still people think it's not long enough to diagnose. But that is the issue of criteria. My clinical experience is that people actually come to me with these sets of symptoms expanded over years. We are talking about years, not months, not even weeks. And they had not realized suffering from depression, they had not realized traveling towards depression, they never realized the depth of their depression. And a lot of times, even when they recover from depression after such a big event, such a big episode, they lose interest in what they were doing or aiming to achieve before developing depression. We surprisingly don't give enough value to ourselves. We always try to give value to people whom we love. And I think that is where the issue is, that we don't recognize ourselves slipping into depression. We just continue providing, continue loving, continue putting things together for our loved ones. So, in short, recognize depression. Recognize depression first. And how would you recognize depression? Change. Any change in your sleep wake cycle, any change in your relationship with food, any change in your intimate relationships or emotional contacts, any change in the relationships with people we love and value in our lives, any somatic symptoms, lethargy, tiredness, lack of energy, not wanting to do things, and then our attitude. Our attitude has changed, and people have started picking on us that this is what has changed. And then, further to it, is it continuous? Is just ongoing? Gradually, I can feel myself going downwards. I'm on a downward drift. What should I do? I don't know whether I'm depressed or not. If I go to a GP, I'll get a prescription of antidepressants, but will it be the answer? Or I'll be guided towards some kind of a talk therapy there. What will I be doing? Talking to people, telling the strangers what my life is like. All these things leads to depression. So don't under-recognize depression, but at the same time, word of caution, don't over-recognize depression either. You've got to be feeling similar for a duration of time, then you can say, yes, it is something. And it must be in the absence of major life event. Unless the life events makes one to develop depression later on is another issue. But in the absence of life event and in the absence of any physical health disorder, most commonly low vitamin levels and low thyroxines or hypothyroid states cause a very similar clinical presentation of depression and can very easily be diagnosed with depression if physical investigations are not being done. So physical investigations are also integral part of the assessment process. You're feeling all these symptoms, you have satisfied the duration, you go to the doctors, get your physical test done. If it is vitamin D deficiency or low thyroxine in your body, then of course that treatment needs to be done first before going on antidepressants. Antidepressants are useful, but they are only a pill. And how far you expect a pill to take you, a little brown pill to take you, to make your life better. By the end of the day, you are the one who is going to make life better. So the first thing is recognize depression. You ask question, am I depressed? Am I not depressed? It's a very mathematical situation. Once you finish with that, the next stage is, okay, I'm depressed. What should I do? Of course, you're going to go and see the doctor. And at those points, antidepressants prescribed work better. They are far more effective than anything else to start with. And then you can add psychological therapies. You can add other forms of treatment methods you think are appropriate, research-based, evidence-based, and going to help you in getting better. So that was the simplest talk for the day, and I believe we need to meet up again soon. I am going to start some regular streaming sessions when I'm going to take you through all the recognized mental disorders by the book, and also talk about some techniques which you can use at home, very much DIY psychiatry, and get better, improve your quality of life. Everything which I'm going to discuss comes with a little plan and an effort, and I'm sure people will find it helpful, listener will find it helpful and beneficial. For now, goodbye.